I'm going to talk to you because it makes me nervous otherwise.
That's absolutely fine. That's absolutely fine.
Engage with each other.
Okay.
CIDGO, who
Yeah.
is it when it's at home?
Right.
And what does it do?
Okay, so CIDGO is the Center for Infectious Disease, Genomics, and One Health. So this is an institute back at our university, at Simon Fraser University in Vancouver, Canada. And there, Charlie and I are part of a team that works on developing methodologies for creating ontology-based data standards, and also developing ontologies for food safety, public health, environmental surveillance, and lots of different kinds of things.
Okay. That and the 10-step process part of it. Someone.
Yeah, right. So at CIDGO, we've spent one of our main research focuses, or foci, is the development of methodology for data standards, and there are multiple components to that. So one is a modular interoperable framework that was based on an ISO standard that came out for whole genome sequencing a few years ago. We participated in developing that, and we adapted that. And created a modular framework. And when I say modular, I mean that the standardized fields and terms are grouped together in thematic modules. And that's just a way of organizing the different standardized fields and terms. But the nice thing about the modules is they're kind of plug and play. So you can actually build a data standard for pretty much anything just by reusing the modules or adapting them, like the contents of the modules, for the specific pathogen or the specific target of interest that you're doing a genomic surveillance initiative or program for.
And the part of the 10-step process is we realized that ironically we're talking about data standards, but we hadn't standardized how we make them.
Standards.
So through the experience that we have at both CIDGO as well as through working with our collaborators at Phage and that group, we've kind of been able to narrow this down into these 10 major steps that you need to do to get a data standard that is consensus-based, that is an ontological approach, and that also is community-driven, which is a really important part of uptake.
The community you kind of had in mind initially, was it specifically Canada? Or
So, I mean, that's how we got involved in this process to begin with. Over 10 years ago, we were involved in a big project to create a bioinformatics platform called IRIDA for Canada. That was originally developed for public health, but now it's been expanded to use by lots of different federal agencies and provincial agencies across the country. And part of that was creating ontologies to help standardize the contextual data. And so a lot of that work was how we got started. So the intention was Canada originally, but then we started working with Phage and working with other organizations who are all dealing with the same challenges. And so so
in the same way that we add power to national databases by making sure that the provinces can share things, it makes sense that we do that globally as well. Mm-hmm. And that's one of the powers of working with Phage, to be able to have that global coalition and to be able to think of things that we wouldn't have been able to think of if we were coming purely from a Canadian lens, right? Mm-hmm. And that's how we can make this data interoperable and ensure that the benefit doesn't just stay in the region that it was captured in, but actually can be worldwide. And that goes both ways.
Mm-hmm.
And you have found that the framework is sort of viable enough to other contexts? So, and how are you testing it? What does Phage allow you to do? Testing it in other?
So, yeah, I mean, I would say that the methodology, the 10-step process and the framework were developed by CIDGO, but they were sort of perfected, I guess you could sort of say, by testing it out in the international context. So working with other labs to develop standards is really all about co-creation and getting feedback from labs in different settings that are doing lots of different things. And so we really, with the input and the help of those different partners, we really sort of iterated upon that methodology until we sort of were able to crystallize or to distill it into 10 steps. So, I mean, we sort of laid the foundation at CIDGO, and then we were sort of able to perfect it, if you will.
So with this 10-step process, a couple of the steps, one of which we spoke to today, is the needs assessment. And in order to do a good needs assessment and understand the data need and the contextual data that you need to structure, you need to speak to lots of different people in different labs, and Phage is really brilliant at that. Being this community partnership and this coalition, it gives us the opportunity to engage with more communities, different laboratories, from public health agencies that we otherwise wouldn't be able to. So I think that's where the strength of Phage comes in, is that it is giving us the wider stakeholder group and audiences. And then one of the steps as well is that encouraging community uptake. And what a better way to encouraging community uptake is then to leverage, again, those relationships that we're building here.
Has the meeting in Cape Town, the one day of meeting in Cape Town, has that helped?
I mean, there are worse
fantastic.
settings.
I mean, one, just being in Cape Town is really fantastic. This is a gorgeous setting. It's a beautiful day. We've had such a great experience in the School of Business here. The facilities were fabulous. But also, I don't think we've ever been in a workshop where people were more engaged.
Yeah.
So bringing people that are actually involved in standards development, they were asking us tons of questions. So it's been really, really fabulous.
Yeah, really refreshing.
Yeah.
And a nice chance to, I think, to build that rapport and relationship and know that we're all having similar problems.
Yeah.
It's not just you, and I think it really helps to not feel alone when you're developing these standards. So
let's just be doing the little pause so we can cut.
Right.